So good morning. It's really great to see you guys. Welcome. I hope that you are all enjoying SAEM. Thank you for taking time to attend this. So this curriculum we put together, it was developed by the Simulation Academy as kind of a crash course in the very basics of debriefing. So in this room, I just want to get a show of hands. Who's a resident? Awesome. Who's faculty? And who's never done simulation facilitation before? All right, so everyone has some simulation experience. Who's done simulation facilitation, but maybe just not as much as they would have liked? All right, and who's done a lot of simulation facilitation? All right, fantastic. So we have a good range of experience levels here. So what we're going to do in the next hour is this curriculum is really intended to be a very basic introduction to the basics of debriefing. For those of you who are new in the room, we hope that this will give you a groundwork in how to facilitate SIM. For those of you who are experienced, we hope that this curriculum, which we're going to make publicly available and we intend to publish, will be something that you can take back to your institution and that you can use to work with people who are new to debriefing and get them experience for whatever curriculum that you have developed. So before we get started, I want to take a moment to introduce our presenters. We're all members of this SIM Academy. So I'm Tina Chen. I'm from St. Louis University, and I'll just have you guys go around the room.
Hi, everybody. I'm Susie Bentley. I'm from Elmhurst in New York City.
I'm Sarah Hawk. I'm from Rush in Chicago.
Danny Lugassi, even his. I'm from Elmhurst Hospital also.
Tiffany Modell, Brooklyn School of Medicine at Louisville.
We're recording, so that's why I'm here. I'm Charles. I'm from Vanderbilt. Hi, everyone.
All right, and then and what I'm going to do is I'm going to let Susie get us started.
Great. And Stephanie Stapleton, one of our fearless leaders on the project, is unfortunately not able to join the conference, but she's been really involved in putting this all together as well. So thanks for being here. Really excited to have the next hour with you all. So overview of what we're going to do. So we're going to do introduction in 10 minutes or less, again, meant to be very quick and very introductory level. Then we're going to go through some videos of common debriefing errors made by novices, talk a little bit about the impact on learning that those errors can have and how to avoid them. And then we'll end with role play scenarios intended to put you all through some common situations and really have some fun in the hot seat debriefing. So our objectives are really to talk about what is debriefing, why we debrief, what are elements to successfully structure debriefing. We'll be using pearls as an example, and then talk about some best practices. So jumping straight in. So what is debriefing? So debriefing is a form of reflective practice. Oh, I love it. A whole bunch of people coming in. There's a table up front and on the side as well if you guys need more space. So it's a form of reflective practice, and it provides a means of really reflecting on action and forms the basis for continuous learning. Or more simply put, it's really a facilitated conversation. So debriefing can be done after simulation or after a real event, done very much the same way. And it's really the learning tool that allows us to take information away that we can apply in the future and learn after an event. And again, reflection, you'll hear that word over and over again, is really how we analyze what we've been through to then be able to learn from it. So SIM, sounds like everybody is familiar with simulation at this point, really allows learners to safely practice and to safely make mistakes, right? And we want people making mistakes, stretching themselves. And then debriefing is where we evaluate the decisions that were made, talk about what went well, what could have been done differently, and then just work together to improve understanding. Why do we do it? Experience alone does not result in lasting learning. And actually, experience alone sometimes can lead to negative learning. Because if you do something incorrectly or not as well as you could have, but you have no way of debriefing or talking about it or necessarily analyzing it in a productive way, it may just reinforce something that you did that was incorrect. So deliberate reflection, what we're going to talk about today, really focuses on not just the what of the event, but really the why. So how do we do it? So there's many different published tools, and I think this tends to be a little bit of debriefing culture based on what institution you are, what fellowship you were at. People tend to debrief with one tool or several tools, but similarly. But there's lots. We're not here to debate kind of the pros and cons of them, but what we're here to suggest is that everybody forms a structure that works for them and that they do it the same way every time in a structured manner. Every tool, every debriefing really there's 3 main phases, and this doesn't vary a whole lot, and that's reactions, analysis, and summary. Reactions, exactly what it sounds like, is meant to be the emotional feelings experienced during or from the case. And again, this is where I like to say the emotional state. This is not like, you'll get learners time and time again, how did that feel? And they're like, I feel like the CPR wasn't great, right? So that isn't a feeling. That's actually your thought. That's your analysis. That's coming later. So, frazzled. I feel stressed. I feel great. Those are emotional states. It's really kind of silly that we need to clarify that, but everybody wants to just jump into the analysis. But there's lots of literature supporting that you kind of need to clear the air first and get everybody through that, and then get into the analysis, which is what everybody wants to talk about. So analysis, the meat of what went well and why, and what could have been done differently and why. And again, what could have been done differently, opportunities for improvement, lots of different ways that people phrase that, but very, very important for the positive and the negative, but getting into the why, right? Because that's where the learning happens. That's where we understand why we did or didn't do something and collectively really analyze it to do better. And then a summary. What have we learned? What are the key take-home points? What did this reinforce that we do every time that we want to make sure we continue to do? So a common structure, and the structure, and you have it all in front of you, that we're going to use today is the Pearls Healthcare Debriefing Tool. Commonly utilized, publicly available, it's free, you can download it. And it expands a little bit on the 3 core phases into 5 phases, beginning with setting the scene. And again, pre-briefing is a topic unto itself, super, super important. And this is kind of a little bit of a recap of the pre-briefing that you would do before the SIM. But again, creating psychological safety, setting the expectations, even as basic as, we're going to take 20 minutes right now and debrief so people know and they're not like, oh my God, I need to get back. Why are we still talking about this? Really, really emphasizing and reinforcing why confidentiality is of the utmost importance for the debriefing, for people to feel safe and comfortable to learn together. And then perhaps most importantly, explaining the purpose of debriefing. And I can't hit this home enough, but really that it's an analysis of all of the events, and it's not about what any one person did or didn't do, right? And it needs to really be framed that way, and you need to stick to that as you go through it. So reactions we talked about, description, analysis. There's many ways to do the analysis phase. Some of the faces in the room that I know are more advanced with this. There's lots. We're really going to focus today on plus delta, which is really talking about plus, what went well and why, and then delta, what could have gone differently and why. And that's just because it's very, very simple, and we only have 50 minutes. And then again, application, so any outstanding issues or concerns. Okay, someone asked a question, we're going to wrap up. What are the take-home points? What did we learn? What did this reinforce? So some best practices to remember in debriefing. Again, beyond how important it is to have a structure and really try to go through the phases every time, especially if you're newer starting out with this, is like everything in med ed, everything in SIM, everything in general, right, is to focus back on your objectives. So you can have a learner-driven debriefing where you're opening it up to see what they think, were the pluses, were the deltas. But again, always anchoring your debriefing back to the objectives of why you did the simulation, what the learning objectives were to start with. Asking open-ended questions. So no yes, no questions, unless you want a whole group of people to just be like, yes, and then stare at you, right? Make your own lives easier and maximize your learning, so open-ended questions. And a really, really important one is shutting your own mouth to listen. So deploying tactical silence. And I encourage you in general in life, but the next time you're debriefing, to really notice how much silence others use and you use yourself, because especially as physicians, we do a particularly terrible job of this, and we all fill the silence. Right, so much easier said than done, but the need for silence is super important, and get comfortable with that. Because if you can be comfortable with it and wait, the learners will realize you're not going to fill in all the blanks for them, and then all of a sudden it'll open the floodgates, and that's where the real learning will happen. So in summary, debriefing is a guided, interactive, collaborative discussion allowing for reflection on action, with the goal in the process of continuous learning. Debriefing structures, there are many. We're going to talk about pearls today, but they offer a framework that we encourage everybody to use to really have an organized discussion. And then some best practices we just went through, anchoring on your learning objectives, open-ended questions, and really deploying tactical silence. Happy to answer any questions, otherwise we're going to just keep on moving.
All right, thank you, everyone. Thank you, Susie, for that really great introduction. Are there any questions from the group?
Do you want me to get the video up?
Where's the mouse? Oh, it came over.
Do you want me to get it? You introduce it and I'll get the
All right. Okay. So during the next 15 to 20 minutes or so, what we're going to do is we're going to build on what we just heard in the introduction. So we are going to observe some examples of debriefing. We've made
All
some
right,
videos.
nice job, everybody. Let's take the
We've made some videos. Some of these videos are examples of good debriefing, and some of these videos are examples of what we're going to call suboptimal debriefing, which are common errors kind of made by people who are learning to facilitate SIM early on in their careers. So, by the way, these videos were filmed by members of the Kaiser Permanente Central Valley Residency Program, and we want to give a particular thanks to Dr. Howard Young, because he did all the filming, he did all the editing for these videos. So we're going to start off with a video that we feel represents an example of good debriefing. So this video is about 3 minutes long. In this video, the facilitator leads a group of learners through a debrief after the learners have gone through a cardiac arrest simulation scenario. And throughout this video, I'm going to be pausing every once in a while to talk about phases. The facilitator uses the PEARLS debriefing structure. I'm going to be pausing every once in a while to introduce the phases and just show how the facilitator uses that structure to her advantage. So as we start the video, the facilitator is going to start by setting the scene.
next few minutes and kind of just debrief after that case. Kind of as a roadmap of where we're going with this debrief, let's start off with hearing some of your reactions. I want to get some of your emotions and feelings about what happened. Then we'll recap the main steps of the case. We'll analyze, kind of the case and highlight some of the actions that we're taking and some of your thought processes and decision making behind what you guys did. And then we'll follow it up by summarizing and doing some take-home points. Cool? All right, again, I wanted to just, reiterate something that we always talk about in SIM, right? Everybody here is in a safe space. What we talk about here stays here, right? All we ask is that you do the best for the patient that's in front of you, right?
All right, so the goal of the facilitator here is to reinforce psychological safety. She spends a couple seconds telling people how they're going to spend the next few minutes of their time, and then she again describes that this is a safe space for open discussion of people's thought processes, and she really develops that safety for the learners to have an open discussion. So what we're going to see next is we're going to see the facilitator explore the learner's immediate reactions to having gone through the simulation scenario.
All right, let's get some one-word impressions on how you felt.
Okay.
Stressed. Great.
Wow, that's kind of a broad range of reactions. Does anybody else want to share your feelings about the case?
I thought that was a pretty classic case of cardiac arrest, but as always, there's always stuff to improve on.
It's been a while since my last coach. I felt a little bit rusty.
Yeah, thanks for sharing this. That's exactly why we practiced, right? This sim kind of gives you a more recent code to reflect and learn from.
So what the facilitator has done is they've given the learners an opportunity to release any emotions they feel about the case. And again, this is very important because if you have a stressed out learner, for example, who's ruminating on how that case went or what mistakes they made, they can't engage in the debrief, they can't engage in that reflective learning, and they don't really get that full value out of this educational time. So the next phase that you're going to see is the description phase.
All right, let's get started on recapping this case. Doc, do you want to go ahead and lead us through a summarization?
Yeah, I thought this was a pretty straightforward VFib arrest with a STEMI patient. We gave epinephrine, amiodarone, shocked the total 3 times. We got the patient back, then we sent her to the cath lab.
Great. Anybody else in the group have anything else, any additional thoughts?
No, I agree. Yeah, I would say that's a great summary.
Cool.
So the goal here is to get everyone on the same page about what events transpired during the SIM case so that the learners have a shared mental model for the debrief. So what we're going to see next is the analysis phase. And as Susie mentioned, this is the meat of your debrief, right? And everything that you've done up until this point is really just to set the learners up to engage in that open discussion so that they can, and in this section, the facilitator is going to have the learners begin to reflect upon any performance gaps that they experienced during the case.
All right, so I saw a lot happening in this case, and I'm really interested in hearing some of your thoughts from the group. You know, what are the things that you felt went well, and what are some of the things that could have gone differently?
Well, we got the patient back, so that was pretty good.
I did make a mistake with the meds, though.
Yeah, actually, I'd love to talk about that a little bit more. So I noticed that amiodarone was ordered, and I think given, but there really was no readback from the medication nurse about the dose or the medication that was given. And I'm worried that it might have resulted in maybe the incorrect medication that was administered and could have harmed the patient. How do you guys see it?
I'm actually really glad you brought that up. That bothered me a lot, too. I heard an 8 word and just assumed it was adenosine because I treated a patient with SVT pretty recently.
Yeah, I mean, this could be something that could happen in real life, right?
Yeah, you know, I've actually seen somebody get fentanyl instead of phenylephrine in a code situation. And I think it's just because codes are often pretty confusing, communication is difficult, there's a lot going on, a lot of noises, and so things just kind of get a little cumbersome.
Yeah, great point. Let's talk more about communication. Is everybody familiar with closed loop communication? Great. What does closed loop communication look like, and why do you think it's underutilized in the real world?
All right, and what we're going to see next is we're going to see the application and summary phase.
All right, great conversation, everybody. So the main takeaway points are the importance of closed loop communication, right? And speaking up and asking questions when something just feels off or something feels different. And any other take-home points you guys can think of? All right, nice work. Let's move on.
And this is an opportunity for the facilitator to reinforce some of the takeaways from the session and also to reinforce her learning objectives for the educational session. So we just seen an example of a debrief from beginning to end. I hope this is a helpful illustration of how a debriefing structure can help you to scaffold an open-ended discussion with your learners. Does anyone in the group have any questions before we keep on moving on? All right, fantastic. So now we're going to see some other examples of debriefing. So we're going to watch 2 additional videos. And after each video, we're going to take a few minutes to discuss the facilitator's actions. We'll do it in small groups. Some of the behaviors in these videos are optimal, but some of them are suboptimal. Again, they reflect common mistakes that we think that we see early simulation facilitators make. But they are common issues, so I think it's a smart idea to view them and to address them. So we're going to start with the first video, and we're going to play this one for about a minute.
All right, everyone, so let's talk about how that case went. As always, this is a safe spot. Plenty of room to ask questions and be curious about what's going on here. Nothing leaves this table. So I thought it went really well. What do you guys think?
Yeah, I actually thought it went really well.
Mm-hmm. Yeah, totally agree. Totally agree. Okay, so you guys did great. Anybody want to summarize that case for us?
Yeah, it was a patient that came in with pneumonia, I think, was short of breath, needed oxygen. I think we considered intubation.
Mm-hmm. So when you walked in the room, okay, I noticed that the patient was obviously in respiratory distress, right? And so you have to be able to remember the basics of somebody in respiratory distress. So those signs are going to be things like tachycardia, tachypnea, accessory muscle use, diaphoresis, all those things that you can. Okay, now I noticed that you were struggling a little bit when the.
All right. So what we're going to do is we're going to get into small groups. We'll each go to a table, and then we'll talk about what we just saw. Okay. Are we in a good position to wrap up? All right, fantastic. So I heard a lot of good discussion. So I think that the main takeaway here is that really great simulation facilitators, they give learners opportunities to speak. They give learners opportunities to reflect on their thought process. There can be a real temptation to fill the silence, but doing so doesn't give the learners a chance to do that reflective learning, which is really important. I don't know how to make it louder. How do I close it? Okay. All right. So now what we're going to do is we're going to watch another example of debriefing. This video lasts about 2 minutes. In the interest of time, I'm going to skip ahead a little bit. We'll start at like 28 seconds if we can. So,
Okay, everyone, let's take a moment to debrief. Remember, debriefing is a safe space for questions and learning. We're all here because we want to learn and we want to.
we can just play it. That's fine. So, do you skip ahead to okay. All right, great. So, the facilitator, we'll start at like 28 seconds. The facilitator at this point has set the scene. They've elicited the learner reactions, and now you're going to hear one of the learners recapping the case. So, we're going to go into the summary.
Code went. Can somebody give me a summary of the case?
Yeah, we had a patient, went into VFib, I think from a STEMI. We gave meds, started ACLS protocol, shocked the patient twice, I think, and then got her back.
I think that's a great summary. Does everyone agree? So let's get more specific and about some of the management decisions. What went well for the group? What could have gone better?
Well, I think once we figured out what rhythm it that we were able to provide pretty good ACLS at that point in time.
Yeah, I agree, but I think in the beginning there was a little bit of miscommunication.
Let's talk more about that. What kind of miscommunications did you notice?
Well, I wanted to give the patient meds, but I don't think that they were actually ever given.
Yeah, I actually noticed you said at one point give meds, but I wasn't really sure what you meant.
I was busy with the defibrillator. I didn't hear anything at all.
I agree with you. While I was observing you guys, I felt that there were times when the team didn't seem clear on the medications and dosages. I mean, ACLS can be confusing, right? There's so many parts to it. There's so many medications. There's a lot to remember. So let's take a few minutes and review the latest AHA guidelines. Everybody can get that out and review it. How is it important to give patients the right medications?
I think it's super important, right?
Totally. Let's take some time to review from the top. Was this patient in a shockable or non-shockable rhythm?
Shockable.
I agree. What meds do we give for shockable rhythms?
Epi, amio.
Yes. What dosage?
So epi is always 1 milligram IV with adults, and then amio is 300 milligrams.
Yeah, correct. Just to summarize, ACLS has a lot of components, and in these high acuity situations, it's important to have a working understanding of these algorithms. That being said, no one can remember everything. It's impossible. You can always have tricks like a smartphone app or pocket resource. Any other takeaways from the group?
Well, actually, I have a question. So during the case, I knew what meds to give. I knew the dosages, but honestly, I couldn't remember your name, sorry. And I just couldn't really figure out a way to, I don't know if we actually assigned roles. I didn't know how to ask for help without seeming rude. Any suggestions on how to handle that in the real world?
Well, I guess we can talk about that.
All right, and now we're going to discuss that in small groups.